Hi, welcome to the Addiction Recovery Place podcast, the podcast champion addiction treatment professionals around the world. I'm your host, Chris Langley, and I'm very pleased to introduce today's guest, James Mains, who's a certified peer recovery specialist and recovery-friendly workplace advisor at the Susquehanna Workplace Network, which is located in Hartford and Cecil counties in the state of Maryland, also known as the best secret in the county. Welcome to Addiction Recovery Place podcast, James. It's great to have you join us today.
Thank you, Chris.
Really appreciate it. I know you're incredibly busy, James, with everything you've been doing, but we're going to get started on the first question. So can you tell us about yourself and how you began working at the Susquehanna Workplace Network, please?
Yeah, so I came into recovery 9 years ago. And at that time, I was a chef. I was working for an international company based out of Massachusetts. And I loved my job. At the same time, I just felt like there was just more. There was something more. I was going to work every day, but that's all I was doing was going to work. It wasn't a fulfilling thing for me. So I had considered leaving for a long time. And, as they say, God does for us what we can't do for ourselves. And COVID hit. It ended up shutting down the restaurant that I managed. So I had the opportunity to get into peer recovery work at a local hospital a friend of mine worked at, and I jumped in and loved it. I was able to kind of connect with people that I wanted to help. It was a very forgotten population. The hospital that I worked at was seeing a huge base of psychiatric patients, so there was always a combo of that, substance use and behavioral health stuff that I was really interested in. So I was able to fulfill that need, and I worked my way through the hospital there for several years. I left last October, went to a treatment center, a private treatment center that was a PHP program, a partial hospitalization program. I was a behavioral health tech there. And one day was kind of reading through Indeed and seeing this ad for a new position that was being created for a recovery-friendly workplace in Maryland. They were starting a program to kind of encourage employers to hire from recovery to break the stigma, kind of see recovery as a strength and not necessarily a downfall or, a moral break in someone's character. So I applied for it and was lucky enough to be able to interview for it, got the position, and been here since February.
Goodness me. Well, firstly, congratulations from going from your work as a chef to now doing what you're doing. That's incredible commitment. So no, big congratulations to you there, James. That's amazing. That is absolutely amazing. Can you tell us about your role and how you help your clients in the community, please, James?
So I kind of have a dual role with SWN. I work with the businesses to get them to sign up for the recovery friendly program. And part of that, that there's no financial gain for the company, that they do it because they want to give back and help the community. We have a huge recovery population in my area, so a lot of the businesses are unaware of that. It's an untapped resource, really. Until I tell them, the house up the street is also a recovery house, a lot of them have no idea. And that's staffing that's built into their community right there. Those guys are, want to work. We've got businesses that need the employees that are going to show up and be there. And that's what I'm finding in the recovery community is people that want to work. They've had stumbling blocks and that they just need that opportunity and that chance to get back in it. So I work with the businesses on that part. The flip side, I work with a lot of individuals as well. I visit a lot of treatment centers and do presentations to introduce the people to what we do at SWN. We're a nonprofit and we offer huge amounts of funding for trainings. If somebody wants to get a CDL license, they can come visit us, sign up for the program. It's very quick and easy, no out-of-pocket cost for the participant at all. And we can coordinate schooling for CDL. We have people that are doing phlebotomy right now. We have people that do CNA training for,
Hmm.
nursing home staff and
Yep.
in-home care and that kind of stuff as well. So I really get to work with the entire community.
Yeah.
I see as things are taking off, it's probably going to branch out where there'll be a person working with businesses and one working with the individuals. But I love where I'm at because I'm
Mhm.
in that spot where I get to, fully help somebody and, give a warm handoff to those businesses and put, people in their hands
Mhm.
for
So,
staffing.
so you're involved with the whole community. So you speak to businesses, you speak to addiction services. You're doing the whole service yourself.
I do.
Wow.
I do. Yeah. Yeah. Another advantage of having so much recovery and being in recovery myself is that it's a close knit community and
Mm.
we tend to take care of each other. So
Mhm.
it's nice. I can I've had businesses call me and say, "Hey, I really need someone to start tomorrow on something," and
Yep.
I can get on
Yep.
social media and
Yep.
tap out, and usually before that day's over, I can get someone
Yep.
into a position at a
Wow.
job.
I can imagine the businesses once they've worked with you and they understand what you offer. The
Yes.
scope is just incredible.
Yeah.
So what's the geographical area in your state where you assist people, James?
So I am in the northeast corner of Maryland, right at the top of the Chesapeake Bay, where the bay
Mhm.
meets the Susquehanna River, basically. Hartford and Cecil is we're a suburban area. We're like 40 minutes from Baltimore City. However, it's quite rural, lots of farm area. Especially Cecil County is
Mm.
a huge farm area, so um, it tends to be a spread out area, but um, like I said, loaded with recovery.
Yeah.
Bel Air is one of the bigger towns in Harford County, and um, you can't throw a rock without hitting a treatment center or recovery house. Like
Okay.
it's really built itself up
Hmm.
as being some place to go, and
Mm.
people from all over. I'm seeing it, when I get to meetings and stuff. There's people from all over the country are coming to the area
Mhm.
for recovery.
Mhm.
We also have Ashley Treatment, which is a huge treatment outfit. That's in Havre de Grace, so
Mm.
it's on the map for recovery for sure.
Why do you think that is?
Um, I think our being between Baltimore and Philadelphia, we're on that, what they used to call the Heroin Highway, which was 95 between Philadelphia and Baltimore. Um, I think it attracted people for a time period for the wrong reasons, and now it's kind of turning around. And we've kind of taken ownership as a recovery community.
Mhm.
We've taken back that highway and made it a recovery highway.
Yep, that's wonderful to hear.
Yeah,
That really is. That's incredible.
thank you.
So what are the roles that your colleagues do, and how many team members do you have working at your organisation? Would you say?
So right now, Swin has, I believe, about 50 employees total. We have the career centers, the workforce development centers. In those, we have career specialists. Our Havre Grace office has a youth coordinator as well as adult service. The youth coordinator handles anyone 18 to 24. The adult services are 24 and over. Um, they handle the actual, funding for individuals to get trainings for, it could be, like I said, phlebotomy to nursing to CDL license is our big one.
Right. Yep.
Um, Same thing in our Elkton office. We have a youth coordinator as well as the adult. The Elkton location also has state representatives. So people that are collecting unemployment can come in for unemployment services and that kind of stuff. It's a lifeline to the community. A lot of stuff went virtual after COVID. So people that are looking for a face-to-face interaction to answer questions, the Elkton office is always busy, always busy. And our offices also, we have computers, scanners, and printers and that kind of stuff as well. So people that are looking for jobs can come in and use those for free. All of our services are at no cost. And in history, we've had people come in that couldn't even afford shoes for the nursing program, and we found the funding to be able to do that for them. So people that are truly desperate and want to change their lives can come in and A to Z find services.
Goodness me! Wow, this just sounds an amazing service. I'm kind of blown away at kind of hearing the scope of what you offer. The whole
Yeah.
organisation.
Yeah.
It's how are you funded?
So my program in particular, we're funded federally from
Okay.
grants and from the state. My program is funded by SAMHSA for the state opioid response grants, which are SOAR grants for short. SOAR kind of looks at recovery in a complete way, that from medicated assisted treatment to aftercare to housing to social services. The SOAR grants cover everything. They the purpose is to meet whatever needs somebody in treatment or recovery may need. So the SOAR grants pick that stuff up, and that's how recovery friendly workplace has began, was from one of those SOAR grants. And I also want to add in that SAMHSA, especially when they set up those grants, picked the top 10 states that had the most overdose issues and needs, and 15% of their budget immediately was earmarked for those states. So they really made sure when they set up the programs that the money goes to where it needs to go to, and where it's needed the most, which was important.
Very, very important.
Mhm.
You touched on something earlier, James, the recovery friendly workplace program. How does
Mhm.
that work? That sounded fascinating to me.
So that it kind of gives a framework, for a business to be able to hire someone from recovery and to be able to meet their needs, to make sure it's a safe space. The two high points of the program are to get overdose response training inside of the workplace to as many people as we can. Um, so far in the state, there's three regions for the recovery friendly program. My region is the Susquehanna region, which is Hartford and Cecil. And then we have another recovery friendly advisor that's in Western Maryland, and one in St. Mary's County, Maryland, which is down the southern region. Um, so between us, we've had overdose response trainings for about 200 individuals, and all of those people leave with certifications in hand, and most importantly, naloxone in hand. I've set up here in Hartford and Cecil with Voices of Hope, which is a opioid, started as an opioid based outreach program, and they've just blossomed into something that it's one of those organizations I can't imagine us not having in the region, especially how things went with the opioid epidemic itself. I can't imagine not having that for us here. But I work alongside them. They provide the training as well as the naloxone for the individuals that complete the training. For instance, we did Chesapeake Care Resources, which handles housing and a day program for developmentally disabled. We went in and did a full staff training. That was one of the first ones I did, which was for almost 100 individuals. We did the program, and it's funny, recovery friendly kind of started out aimed at the individuals in recovery, but from that one training, it kind of helped take things in a different direction, because there were so many family members of people who, were in the midst of addiction, and those family members didn't know what to do. I had two women in particular during the training that kind of came out that they had lost a child in recovery, and to an overdose, and had never talked about it at work because they just didn't feel like their job was safe. And um, Chesapeake Care Resources joining the recovery friendly program, kind of um, help them see that there's other individuals, that lost children, that there's a whole support and resource network out there for them. Um, and that kind of brought home what I want to see with the recovery friendly program, is that people who didn't think that they had anybody to turn to, there's a whole network. And eventually, we'll connect those businesses so that, staff members from one business can lean on another business as well, and find those supports that they need.
Yeah. You mentioned something earlier, James, where you said that two mothers who had lost their children
Hmm.
for overdose couldn't talk to people at work about this. Is this
Yeah,
stigma?
the just the stigma. Yeah,
Yeah.
they were worried about being judged.
Yeah. Gosh.
I think that as much as the opioid epidemic has opened people's eyes, I think there still is a little bit of gosh, I guess people feeling like it's not in their area, and until it's too late and it's in your area, and Hartford and Cecil has made great strides in taking care of each other. I wasn't sure, when I entered recovery, it wasn't something, I went to work and talked about right away. There was a little fear that there would be that judgment and that
Of course.
stigma happening. So
Sure.
I when those moms shared that, that they had lost children, I was like, I can't imagine, th- I'm very mouthy and very open now. So I can't imagine being in that situation where, I can't even say to my coworkers, my kid died, they kept that quiet and kept that, inside. But, it, like I said, it kind of brought forth what I wanted to see from recovery friendly, and to drive home the fact that you don't have to have had a needle in your arm to be in recovery. There's the family members that suffer along just as much.
Hmm. We mentioned stigma, James. How do you think we can move away from this to make sure that anyone needing to access a recovery program for their addiction can attend without having the feeling of stigma and rejection, or there's this social elements around drug use or mental health issues that stops people entering treatment because of just community stigma. I mean, from what you've just told me with your recovery, friendly workplace program, this is really helping with this, which is just wonderful to hear. But how do you think as a society we should be moving away from this and to help people into treatment? Because it just seems so outdated now.
I think, gosh, I think education, above all.
Hmm.
Um,
Yep,
I
that's a great answer.
I think, well, I think programs, not just recovery friendly, but I think programs that kind of introduce people, you know, um, I tell everybody I work with, you don't have to tell everybody you're in recovery, but just know that that is the most important thing that you can do, is to tell people, you know what, I'm an addict, I'm in recovery. Um, I used to be that person, walking down the highway at 2 in the morning, looking for money and looking for drugs. I'm not that person now. I think representation is super valuable.
Hmm.
Um, I've met. I used to hate it, but I do get a little jolt sometimes when someone says, I can't believe you used to, be an addict. And I'm like, I correct. I'm like, first off, I'm always an addict. I could be right back on that street tomorrow, but I like that because it means that it got their attention, that they saw that there is a change, that there's that chance that anybody can, go from addiction to recovery. So, but I do think I always try to teach families, especially, about what treatment is. I think that's another important thing. We have the movie version of what treatment is, and then there's the the real world version of what treatment is, and it entails a lot. There's lots of different methods to get from A to Z. There's lots of roads. So I try to I put together lots of packets. I'm a paper person. I like having papers to sit and read through, and I try to do that for the families and stuff that I work with. And I have a packet that explains every what outpatient is, what inpatient is, what PHP programs are, what methadone programs are, and like I said, I think educating people about what recovery really is probably the most important, but um, it's right in there with the representation issue. I think it's important to represent.
Absolutely. Well, you mentioned representation, James, and I'd like to ask this because we had a podcast scheduled for last week, but we had to reschedule for a very obvious reason. That I'd love you to tell our audience about why this was, please, because we talk about representation. I think you're going to nail it with this answer. So please go ahead and tell us what you did last week, please.
Yeah. So part of the RFW program is getting naloxone into workplaces. Construction right now is just slammed with drug use. Honestly, there's lots of overdoses on job sites that are happening. It's not something I was really aware of, and until I started working with this program. And one of the issues, I know people are gonna want the connection, but a lot of construction workers get injured and they end up taking opioids. You know, the way things are set up now, those opioids eventually run dry, and unfortunately, a lot of them are cut off without any kind of treatment supports, and they end up using illicit. They buy pills off the street, or they switch to straight fentanyl. It's just one of those issues that I think hasn't been talked about enough. So nonetheless, I had signed up online for a training, and one thing led to another, and I was getting ready to do the podcast last week, and I got a message in my email box that I was invited to the White House for a panel discussion about getting naloxone in the workplace, and it was attended by hundreds of nonprofits from all over the country. Dr. Gupta, Rahul Gupta, was the moderator for the event, and we were able to sit and discuss what we're doing in our areas, and be able to take some methods and be able to share those with each other was just phenomenal. um, we had a couple celebrities that popped in, Robert De Niro being one. Lost his grandson to a uh, opioid overdose, and Samuel L. Jackson was the other, and he's been in recovery for I believe he said 18 years from crack cocaine. And it goes back to the representation thing. It, it it's hard sometimes for me to get someone to listen, but if Samuel L. Jackson says it, you're probably gonna listen.
Yep. Yep.
So same with Robert De Niro, to have that loss and to be able to turn it into a platform is just amazing. But yeah, so I spent last Tuesday at the White House, and it was excellent event. Excellent event.
It must have been quite an almost surreal experience for you, I guess, in a small way. It must have been like, wow,
It
look at where I
is.
am.
Yes, it's one of those things that after you get home and you kind of decompress, it's very chaotic, it's very busy, it's Secret Service everywhere,
Yeah, I can imagine.
difficult to get in the building, just as difficult to get out. But but yeah, the next day, kind of looking through the pictures while you're decompressing, you're like, oh my God, that was real. It is surreal is a perfect word to describe it.
Well, I mean, big congratulations. When you sent me the email, I said to my wife and business partner, Maggie, I said, well, that's as good of an excuse as any to reschedule. It
I know
really was.
when I sent it, I was like, "Oh my god, is he going to believe me? Because that doesn't even sound real."
It was wonderful.
But
It,
yeah,
it was one of the best emails I think I've had in a long time. So
yeah,
that
thank
really,
you.
really did make our day. And just acknowledging you as well and your service and what you're bringing to your clients. I mean, that's a huge achievement, James.
Yeah, it
It
was.
really is.
You know what? I felt very blessed. The good thing about those events, I mean, part of me still has like that childlike, like, oh my God, I'm going to the White House kind of thing. But
Mm.
to be able to sit down and talk to someone who runs a nonprofit out of a food truck in Harlem is just, it's not an experience I'm going to have out here in Hartford and Cecil, and to see what other people are doing, and just the grassroots, and the boots on the ground. It's very easy for politicians to design these programs, but then to see it from start to finish, and from writing on a piece of paper to myself, and Dr. Felicia Pullen in Harlem, it's to see us enacting and working on those things. It blows my mind. It blows my mind.
Well, keep up the great work, James. It's amazing.
Thank you.
It really is.
Thank you.
So, last couple of questions for you.
Mhm.
What are the future plans you have for the Susquehanna Workplace Network?
So right now, getting businesses signed on. I've the individuals are here that are looking for jobs. So my focus right now is getting more businesses signed on. I take full advantage of the multiple recovery places that we have around. Typically recovery establishments, treatment centers, that kind of thing, hire from recovery. Most of the staff, when you walk in, are people that have lived experience of some sort. So, um, I'm there to make that connection for them. So, right now, my focus is getting those businesses signed up, getting them involved. It,
Just
it's
keep doing
always
what you're doing.
nice. Yeah, it snowballs too.
Yeah,
One
exactly.
business,
Hmm.
they're competitive.
Hmm.
Business owners are competitive, and I can go in and say, hey, you've got a restaurant, and this other restaurant signed up, and they're like,
Yep.
where do I put my name at? So,
Yep.
so it's good.
Wow. Just keep doing what you're doing because it's clearly much, much needed. Um, I ask all of my guests this question, James, because I get some very interesting and varied answers. But can you tell me what your opinion of harm reduction is and how it plays such a pivotal part in recovery?
You know, um, I started off my recovery very abstinence based. I went to AA, and then moved on to NA. Um, I didn't know a lot about harm reduction. I was not educated to it, and in turn, I had a very closed mind about it. Um, I'm not afraid to admit I felt like people that took methadone and Suboxone were still getting high, and I had a very skewed vision of what harm reduction meant. I do believe that's why I hold Voices of Hope so dear in my recovery, because from them I've learned so much about what harm reduction is, and it's about saving lives. When you get right down to the bottom of it, it's about saving lives. And if somebody needs to be on a medication, um, if my mother's diabetic, I wouldn't tell her, insulin's a cop out, lose weight. And I tell people that all the time. I'm like, you wouldn't tell someone with diabetes to do that. You wouldn't tell someone with cancer, you know what? Stop eating all that fatty food, and your stomach cancer is going to get better. So I um I look at it as it's saving a life for today. And if that strip of Suboxone or that dose of methadone, or you coming in and bringing me a dirty needle to get a clean one, if that saves your life for today, then that's the most important thing.
There we go. Yep.
You know.
Perfect answer. Thank you so much for that, James. One last question. You're a member of NADAC. Can you tell us about how being a member has benefited your career and your training?
So I love NADAC. I didn't know anything about it. I'd heard about it when I worked at the hospital. I'm lying, and I had done a couple trainings through them, but they have been such a support system. They have a huge conference coming up, and I'm not going to be able to attend this year, but it is a goal to go next year. But NADAC offers so much support, not just on a national level, but on a state level. They have a huge state presence and boards, I believe, in every state. The trainings that they offer are just, it's top-notch stuff. It's up to date. The instructors are so unbelievably helpful, and there's been lots of times that I've sent a midnight email like, I attended this and I can't stop thinking about it and I need more information, and they deliver. I've never been disappointed in the customer service aspect of NADAC. But I think it's important for all of us to have those, those ties and an easy way to connect with other individuals that are out there.
Most definitely. Most definitely. James, do you have a message for anyone listening to this podcast who is going through addiction or some mental health trauma at the moment?
Yeah, I think it's important, not just because I'm in peer recovery especially, but, peer recovery has become such a huge thing. And the good thing about that is that it's spreading into areas where help wasn't available before. If find that person that's in recovery and listen to them. That so many people are concerned, that they can't get medical help, and start light. Find out what your resources are in your area and the supports. Reach out to the health department is always a great place to start, and places like Voices of Hope, that have peer on staff and that kind of thing. I'm finding that those kind of organizations are really taking off, especially in rural areas, which is very promising. And just know that recovery doesn't mean treatment. Just because you're asking about recovery doesn't mean you're signing yourself up for 30 days of treatment. There's a bunch of options out there, and something to meet your needs.
That's right.
There's a help for everybody, I believe.
Yep. Awesome. Thank you, James. Last question. Can you tell our listeners how best to contact you and to find your service online?
Yeah, so Susquehanna Workforce Network has a website. I'm going to have to pull out my card. I should have had it ready. I'm embarrassed.
No, don't be.
Myself, I work in Harford and Cecil County, so I am always available. You can connect with me at jmains@swnetwork.org. Our website is also swnetwork.org, and you can contact us through there. Everybody's emails are listed on the website as well. I also have a phone number. I'm available for text, calls, whatever, at 443-866-6802. And although I'm in Maryland, don't hesitate to reach out if somebody has a question and lives in a different area. Like I said, I've met some people the past week and a half, so
Sure have.
I have some feelers out everywhere. So if somebody needs help in another area, don't hesitate to reach out, and I'm always glad to help. And if I have to sit on the computer to find someone a resource, I'll glad to do that. So
well, James, it's been a real privilege and an honor to speak to you today. And the work you're doing, your service is exceptional. It's been really amazing to hear about the scope of what you're doing, because it's huge. It's the whole person. It's the whole life of someone that you're helping. It's not just necessarily the addiction or the health issues, but it's the whole picture that you're doing, and work and housing and employment is it's so important as well. And it's something that's forgotten, but what you're doing, you're delivering the service. And it's wonderful to hear that this is happening. So thank you very much for everything that you do. And please send your team my very best wishes. And it's been great having you talk today. Thank you so much.
Will do. Thank you so much, Chris.
Really appreciate it. Thanks, James.